Welcome to our webinar, A Patient Panel, Life After Transplant. Thank you for joining us. My name is Lee Clark, Senior Director of Patient Services, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generous support of our corporate sponsors and the generous support of our patients, families, and caregivers for supporting our program today. It is possible you may lose your connection during the program. If you do lose your connection and you're unable to view the program online, you can call in to hear the audio portion using the call-in number in your reminder email. Our program today will be archived to our website within just a few business days. You will be notified by email when it is live and ready for viewing. During the presentation, this will be a question and answer program. Please feel free to submit your questions at any time during the presentation. To submit your question or comment, open the Q&A window in the lower part of your screen. Type your question in the small text box window, and we'll get to your questions throughout the program. We will do our best to get to everyone's questions today. When asking questions, I do ask that you do two things to help me manage the incoming questions. Submit your entire question all at the same time. Second, please do not share private health information in your question. Our speakers cannot answer any specific questions related to your health care. I'd also like to remind everyone that our panelists today are patients just like you and are not medical professionals, so they'll just be commenting and sharing their experiences throughout the webinar. Our panelists today, we have Deborah, Rohale, and Karen. So thank you guys so much for joining us today. We're very excited for you guys to be here with us.
Glad to be here.
Yeah, well, we'll go ahead and get started. And I'd like everyone just to take a minute or two and do a little introduction. Deborah, would you like to start first?
Sure. I'm Deborah O'Neill. I live in Delaware. I was initially diagnosed with aplastic anemia in October of 2017. And I started out with doing immunosuppressant therapy. So that was the ATG horse, cyclosporin, and Promacta as a regimen. And I had some level of recovery. I'd been out of work a little bit for that, and then my blood counts returned to somewhat normal, and I thought things were going to be better. Unfortunately, in the summer of 2019, after I guess it was my third 6-month check, my count started to tank again, and my local hematologist referred me to a specialist at Johns Hopkins. And that discussion was, you could try immunosuppressant therapy again, but it was unlikely to move forward, or bone marrow transplant. So my counts continued to go down very rapidly. I was being transfused at least platelets twice a week and blood. So we went with the bone marrow transplant route. In May of 2020, we found a match in March. I had a transplant in May of 2020. So now I'm a little more than 2 years post-transplant at this point. And I'm happy to say my blood counts are back to normal. I don't even think about them. I returned to work after a 4-year being out up and down with my health. And so I feel like things are whole again for me in regard to my health and well-being. So I'll leave it there. I'm more than willing to ask more questions about the journey, because it was more longer than the Reader's Digest version I just gave, but just to give you a sense of the various things that occurred.
Thanks, Deborah. Karen, would you like to go next?
Sure. I was diagnosed in June of 2021 with MDS, high risk MDS, and started on a regimen of Vidasa which I would have 7 days of Vidasa and then 21 days off in preparation for a bone marrow stem cell transplant, because it was determined that I had a genetic mutation that pretty much guaranteed that my MDS would transition into acute myeloid leukemia if it wasn't stopped through stem cell transplant, hopefully stopped through that. So took us a while to get to transplant, and I was March 31st of this year. So I am 6 months old. I had my my stem cell transplant. My donor was my son, who was a half match, and I was in the hospital for 3 weeks, and then was released and had to stay within a few hours of my a few 30 minutes of my transplant center. So we moved into an apartment locally. I'm in Virginia. I'm in Richmond, Virginia, and was treated at VCU. And so we did that. And about a month ago, I was able to go back home, which is about an hour and a half from the transplant center. And now I come back once a week and have my TAC levels checked. And today I had a bone marrow biopsy about an hour and a half ago. So that's why I was late. Sorry about that. But I had a bone marrow biopsy to determine how my donor cells are. And so far, the past 2 biopsies I've had since my transplant have shown that I am 100% donor cells with 0 evidence of my MDS. So I am on the road to healing. You know, had a few issues with graft versus host disease in my skin, and recently getting over a bout with shingles. But I just had I had the first of my immunizations this week. So I'm moving forward to being an adult again. Getting my
Thank
baby
you
shots.
so much.
Thank you.
Thank you so much, Karen. And thank you for being with us after just having a bone marrow biopsy.
Oh, you know, they do such a good job that I'm still numb. So I got my ice on. I'm good to go. In about 2 hours, I'll start feeling the pain. But you know, if you have a good technician doing it, it's really not horrible. So
Thanks, Karen. Rohel, would you like to go next?
Sure. So my name's Rohel. I am 20 years old, and I was diagnosed with aplastic anemia, the very severe form, so very severe aplastic anemia, in May of last year. And I was diagnosed in Dubai. Actually, that's where I was living at the time. And I didn't go through the immunosuppressive route just because of my form of the aplastic anemia being severe. And so I went straight to transplant. So I had my transplant in July of last year, 2021, in the US at Hopkins. And my donor was my cousin. So I had a half match transplant. And yeah, so I'm currently 14, almost 15 months post-transplant. And I had like about a GVHD, skin GVHD post-transplant. But as of now, I'm doing well, cured of the GVHD, and similar to Karen, also receiving my immunizations, my baby immunizations all over again. And so far, my chimerism has been good as well. It's been 100%. And just going up for my doctor's checkups. I have one tomorrow, actually. And yeah, so far I'm doing well. And I am currently in university studying science. So yeah.
Thank you. What led to your diagnosis, your original diagnosis before transplant? Deborah, you want to go ahead and take that one?
Okay. Really, I had the very severe aplastic anemia was the diagnosis. It came out of nowhere. What do you call it? Idiopathic. I joke with family now, you know, that I must have walked through some strange poppy field in the small state of Delaware to find the rarest disease possible. But I was generally healthy, no secondary or underlying conditions. What I did start to feel, you know, when I started that fall was I was having a lot of fatigue, simple things, walking. I live in a 2-story townhouse, just walking up the stairs to the 2nd floor, or walking across the parking lot to enter a building, at work, walking, you know, from one end of the office building to the next, I was just feeling as if I ran a marathon. And while at the time I was 53, I thought, okay, I am getting a little older, but I still thought I should be able to do a lot more, at 53. So I attributed to just the high level of work stress I was under and the activity level. I described as running at 1,000,000 miles an hour, and maybe it was just catching up to me in ways I didn't understand. So I went to the doctor thinking I was going to get some magic cure, high blood pressure, cholesterol, something, fix me and send me on my way. They did blood counts, and the doctor was shocked I was even walking and talking because my counts were so critically low. Platelet count was, I think, 5 at that point. My hemoglobin was well under 7, 6 or 5. I think it was something ridiculous. She was just amazed I was walking and talking. And they took me by ambulance from the emergent care to the hospital, and I never looked back.
Thank you, Deborah. Karen, would you like to go next? What led to your diagnosis of MDS?
I had just moved to my husband's and my dream home on the river, and prior to that was COVID, like everybody was dealing with COVID, and my father passed away that December before, and I thought I was dealing with depression and anemia. I was feeling really exhausted, and I just couldn't shake this depression, and I was worried, so we just moved to the area, so I found a new PCP, and when I talked to her, I said, really all I want is some happy pills and iron. She said, well, no, we're going to do blood work first and see what happens. And when my blood work came back with a white count, I think it was like 1.1, and my red count was weird, and all my numbers looked really strange. She said, I need to come back for let's do another, blood test. And when the second one came back even worse, she immediately referred me to a hematologist. And when I got to the hematologist and he was taking my family history, and I said, my father was diagnosed with MDS at 93. And he didn't have a bone marrow biopsy, but he was diagnosed based on the other symptoms that he was finding. And there was blast in his peripheral blood. So the hematologist did another blood test, and he too found blast in my peripheral blood. So he said, we're going to do a bone marrow biopsy immediately. And when they did, sure enough, 13% blast in my, in my bone marrow. So he said, yep, you've got it. I said, so did I inherit it? He said, oh, that's very rare. And in additional testing, they determined that I inherited a genetic mutation. So like you, Deborah, I got a really rare form of a rare disease. But so that's how it came about. I thought I was depressed and I thought I was low on iron, but come to find out that it was more than that. So that's how I came about finding out.
Thanks, Karen. Rohale, how about you? How did your diagnosis of aplastic anemia evolve?
So at the time I was going to the gym, and so I thought it was because of that. I thought I was overworking myself. I just started getting really tired and exhausted to the point where going to the bathroom, walking upstairs, getting up from bed, literally doing anything made me so tired, so close to passing out. I would just get like a head rush. And sometimes my body would just collapse to the ground, just in fear that, I'd fall flat. And I was losing weight, and I'd become very pale. And at the time I was also fasting. And so I just attributed it to that as well. Because going to the gym, I would do the easiest things, and I would just be on the ground for 5-10 minutes until I'd be able to get up and, move on to the next set. And it wasn't until I think my grandmother looked at me and she was like, something is clearly wrong. You are so pale. You're constantly shivering, because I was always shivering, especially after eating the big feast at the end of the day. And so I went to the doctor, and the doctor said that, there's something wrong. Clearly, like I developed a murmur, but just because my counts were so low and my heart was working overtime, I developed a murmur. And we had to wait for insurance to get the blood test, but my grandfather, he had his own clinic. So I just went to my grandfather's clinic and I got a blood test done. And after looking at my levels, they were like, you need to go right to the ER. I think my hemoglobin was 3, my neutrophil count was 0, and my platelets were 17. So I went straight to the ER, and then I was seen by hematologists. They did bone marrow biopsy the next day. And I think I had 2%, 2 or 5% cellularity in my bone marrow. And so that's how the diagnosis came about. Within a few days, we had the definitive results that it was aplastic anemia.
Thank you. Rohel, we'll stay with you. How long after your official diagnosis was transplant discussed? Was it discussed along with other treatment options? And if so, what were you told about what is a transplant?
So it was discussed quite immediately just because of the severity of the disease. We were told, by we, I mean like me and my family, me and my parents, who were in the room by the hematologist about what the disease is, what aplastic anemia is, and that there's two options that I could go down, whether it's the immunosuppressive route, which is taking the immunosuppressive medications and then having to wait many months to see if there's a response, or going straight to transplant because of how low my counts were and just the risk of getting an infection or getting hurt or anything like that, and then potentially it getting worse. I was recommended to go straight to transplant. So within a week of getting diagnosed, I was already speaking about getting a bone marrow transplant, finding a donor, what a transplant is, what that entails. I didn't get the full picture in terms of that involves chemo and radiation, but I did just get like a brief synopsis of what it is, what it would entail, where I would have to go, because at the time I was in Dubai and they didn't do transplants yet in Dubai or in the UAE, and so I knew I had to come abroad, and so yeah, it was pretty fast when I started figuring out what a transplant is and that I need to find a donor.
Thank you. Karen, how about you? How soon after your diagnosis was transplant discussed, and what did they tell you about a transplant?
It was pretty immediate that my hematologist referred me to VCU. And when I went to the hospital to meet with the transplant team there, he explained everything that was going to happen because of my my risk factor. And because of the blast count number, he felt like that was the direction we needed to go immediately. So I understood right from the very beginning what was going to happen in terms of the chemo and the radiation, because they were very thorough in their explanation, and also the idea that it's my choice and that we were going to begin immediately on the course of Vidasa, the 7 days and 21 to reduce my blast count so that I was ready for transplant while we were looking for a suitable donor. So it was pretty immediate. I felt very informed from the very beginning.
Thank you. Deborah, how about you? How quickly was transplant discussed with you in terms of your options?
Well, initially in 2017, it was not. My local hematologist, the decision was based on my age to go this immunosuppressant route. And I think opposite of Rohel being so much younger, and from what I read in the science, for younger people, that is the route they take, is transplant, because of the toll it takes on your body, and sometimes there's secondary health conditions, especially when you're over 40. Actually, I was over 50 at that point, so that was the plan. But the second time, when I got my relapse in 2019, my counts started to tank so fast, and then I was becoming so blood dependent that we were weighing out the risk factors of, if we went the immunosuppressant route, how likely was it going to do anything different that didn't last the previous 18 months or so? And so at that point, it seemed like the only way to resolve this was transplant. So we went through, similar to Karen, it was a very thorough and intense discussion. This is not an easy decision to make by any stretch of the imagination. It's a complex process. It was also complex for me in the sense that I did not have relatives. I'm an adopted child, so I don't have blood relatives to fall back on. I do have 3 children, and they were excited about the possibility, and we did test them to see if they were donor matches, but my donor antigens were too high for me to consider them as donors. So we went to the registry, and then it was a search for a match from there.
Thank you. And that was my next question, was about your donor. So Deborah had an unrelated donor from the registry. Karen, tell us a little bit about how the decision was made for your son to be that he was the right. I'm sorry, that he was the right match for you.
Well, because of I'm 64. I was when I was 63 when I was diagnosed, and I have 4 siblings. So, initially they want to go with siblings, but because my siblings were older, they're in the 60s, and I think my oldest sibling is 67. They said, we will test them, but just in case we can't find another donor, and see if any of them are matches. And they said, but we believe that your best chance is going to be with one of your sons. So so both of my sons were tested. But in the meantime was when we got the results back that I had this genetic mutation. And they put me through some more testing to determine if it was somatic or if it was germline, whether I'd inherited it or whether it was caused by the MDS. And when it was determined that I'd inherited it, then my sons had to go through the testing to determine if either one of them had inherited this same mutation. And it turns out that one of them did, one of them didn't. And the one that didn't, they put him through the rest of the testing, and he was determined to be the best match for me. And we had no matches through the registry for me. I absolutely nobody matched with me in the registry. So I was very blessed that my son was a haploid match for me.
Thank you. Rohale, how about you? I know your cousin was your donor, which is pretty rare.
Yeah, so my doctors had told me that the greatest chance that you have are I have 2 sisters, to get them tested, because they're the only ones who could be a full match. So they both did go and get tested, but unfortunately they were 0% match to me, there was a 25% chance of that happening. They were full matches to each other, but not to me. So I had a lot of cousins as well, a lot of first cousins. We're all, I'm very lucky, we're all very willing to get tested. And at that time, the doctors had told me oh, I had already gone to the US at this point, because we thought, okay, it would be my parents, either my mom or my dad. Most likely my dad, because my mom, being a woman, probably had, like Deborah had said, the donor-specific antigens. So it was probably going to be my dad. And so I was at the US, and my mom was insisting, the doctors just saying, let us get his cousins tested. We want to just have that option there. And they said, sure, just don't expect anything from it, just because it's so rare. And so I think 1, 2, 4 of my cousins got tested who were eligible. The rest were either too young or had other pre-existing conditions. And I was very lucky that one of my 4 cousins who got tested ended up being my half match. So it was decided then that he would be my donor. He's 16, or he was 16 at the time. And they preferred a younger, healthier donor compared to my dad, who was, I think, 50 or 51 at the time. So it was decided that my cousin would be my half match. And so he flew out to Hopkins, and he was my donor.
Thank you. This question is for Deborah. Were you nervous about your donor being someone that you did not know off of the registry? Did you have any concerns?
No, my concern was not finding a match, because my counts were so low, and like I said, from June-ish 2019, and waiting, I didn't find a match until March of 2020. My concern was that I was so blood dependent, I needed this bone marrow transplant. We also did some blood drives. I mean, I didn't know who was going to show up on the registry. We were talking to everybody we knew. I had churches, groups that I was involved in. Everybody was campaigning and swabbing and trying to find a match any which way. And I said, if it doesn't help me, it's going to help somebody else. So, eventually, that was the plan. My donor ended up being from Germany. So I knew that my cells were being flown in from internationally. And I I was just thrilled that I was able to find a match, and I was healthy enough to continue forward with the bone marrow transplant, because I was continued to having some health decline just with my GI system and just the aplastic and the continued low blood counts. It was just taking its toll physically on me at that point.
Thank you. How did you decide where you were going to have your transplant? Rohil, you want to take that one first?
Sure. So because I was in Dubai, which is in a country, the UAE, that doesn't do transplants at that time. They do now, but when I was there, they weren't doing it last year. And so for me, it was either between coming to Mayo or to Hopkins, just because my doctor had recommended that, both of them are, renowned in their work with transplants. And we had known some people who live within the area, who knew doctors there, and so we were able to get that connection and just have that support being in those cities, but either that's Rochester or Baltimore. But ultimately, it was decided because that I had a half match through my cousin that I would go to Hopkins. It was a decision that me and my family made because Hopkins had done so much work and research in the half match transplant. They pioneered that research, and so we knew that would be our best option. We knew people who knew doctors from there, and so we were able to get that connection. And so that's how I ultimately ended up picking where I was going to go for my transplant.
And you had another choice to make at Hopkins as well.
Yeah, so I had the choice between going the pediatric way and the adult way because I was 19 at the time, and so I could have gone either or. I decided to go pediatric only because I just felt that I would fit in better there. I didn't consider myself an adult yet, like to go through the adult route, and I just thought that it would be a little bit more of a caring system, just because the nurses, the doctors, they deal more with kids, and so they need to be able to have those skills to kind of speak to their patients in a certain way or coddle them in a certain way. And so I felt more comfortable if I was in that program rather than in the adult way. And I was very happy for picking that because my life was a little bit easier going through the pediatric way, because I know that in the adult way, the adult BMT route, for example, their biopsies, they do it awake. Like Karen, I'm pretty sure your biopsy you just did, you were awake. I was put to sleep during my biopsy, so I got all the drugs and anything I needed, they would do it all for me. I wouldn't have to figure anything out on my own, all my schedules or anything. My pills were wrapped in candy if they tasted bad. So I was very glad that I picked the pediatric route.
Thanks, Rohil. Karen, how about you? How did you decide where you were going to have your transplant?
I'm jealous first. I should have asked for the pediatric route. Mine was geography. I live in Virginia, and I knew that I wanted a teaching hospital, and I knew that VCU and University of Virginia both had transplant programs, and VCU to me seemed like a better match for what I wanted. So I chose them, and my doctor had recommended them also. My hematologist had recommended them. So I didn't do a whole lot of research on the different places, but I did know that VCU used a lot of the same protocols that Hopkins used in terms of the half match. When I found out later that in terms of the half match that they followed the exact same protocol. So I felt pretty comfortable and confident that I was getting treatment that was well researched. And the program had been at VCU for over 35 years. So I felt pretty confident about it. So that's how I chose geography. And then I did my research to confirm that that was where I needed to be.
Thanks, Karen. Deborah, how about you? How did you decide where to go?
Initially, my local hematologist referred me to John Hopkins, and one of the doctors there, Dr. Broski, was who he initially referred me to, and I ended up with Dr. Broski, I guess second in order, Dr. Zern. She was fabulous, and I think that I was just researching bone marrow transplants, and so I did a little research to see what else, because I'm here in the Philadelphia, New Jersey area. So I thought, like, I know Penn Medicine's nearby and others. So I did a little just research to see which programs and what these doctors knew. I just felt that the doctors at Hopkins knew more about aplastic anemia. I felt very comfortable with what I learned. And then when I went and met the doctor specifically, I think she was all I needed in regard to treatment and planning and discussion and answering my questions. It resonated with me in a way that I felt very comfortable there, and chose that route. So unlike Rohale, I was on the adult side comparatively for the at Hopkins. And what I would say in comparison, the treatment program is inpatient and outpatient. I did have to live like Karen in the vicinity of the treatment program. So I moved from Delaware to Baltimore to be there. We lived in a residence across the street from the hospital. So most of a good initial few weeks of treatment, I would walk over, and then I felt lousy. So my husband would drive me to the front door, which was just a few hundred feet, but it was enough. But it was in and outpatient. So I would go in for clinic and treatment and then come back to residence. I didn't stay in the hospital, as some people may have experienced, go through this, go in the hospital and stay for their first 30 or 60 days or 100 days. I only stayed overnight, 2 nights when I got my transplant. One, because my transplant was, my donor cells were being flown in from Germany. We knew they were coming in around 12:30 in the afternoon. And they were told that as soon as they were prepped and ready, they wanted me to have them. So they admitted me so that I could be in the hospital and ready when the cells arrived, so they could start that transplant right away. And I did get a slight fever, so they kept me 1 additional night just so we wouldn't have to go back and forth from residence. But that was the extent of my hospital stay, if you want to call it that, in regard to my transplant experience.
Thank you. What things did you do to prepare for transplant? What things did you and your family do to get ready for you to have your transplant? Deborah, you want to take that one first?
Sure. Well, the first thing was relocation was a big deal. Once we decided that we were going to do this, it was trying to plan for that. So there's a waiting list in regard to what Hopkins had to offer in regard to housing options, because you can imagine people go in with a treatment plan and say they're going to be there for 100 days, but this is subject to how people respond. So it's not like on the 100th day they kick you to the curb. So it was one of those situations where it was kind of timing was an issue, and we had to have a backup plan if housing wasn't quite ready when we were ready to move in for my transplant date. So that was probably the first thing. And then secondly was just, and this was just before COVID happened. So to set the stage, we were planning that family would be coming to visit and coming back and forth, and COVID happened. And then I got the news about transplant, and everything changed about who could come and be with you. So we had to really work to discuss who my caregiver would be, because we could only have one at the residence at a time and be with me and at the hospital. And I talked to some other survivors who talked about things like simple things like slip-on shoes, so you don't have to worry about tying them when you have to go to the bathroom. As a woman, I wore tank tops and a zip-up hoodie because you have to have access to your port. And unlike men, having a bare chest isn't a problem, but if you're a woman, that's different. As you can see, Karen lost her hair, so did I. So a friend of mine, we talked about just planning for that. If you wanted a wig or not, you might want to do that before you get into treatment. That way you could have it. And an extension cord is my favorite friend because I'm a techie. So you have to be able to plug into plug your devices in, and usually all those plugs are behind the bed. So having that kept me in my bed and when I was in treatment, and I could stay connected to family and friends with my devices.
Thank you. Karen, how about you? What did you do to prepare to go for transplant?
Well, I knew with my program, you were in the hospital during your transplant process. So I knew that I would be in the hospital between three and 4 weeks at least. And so it was preparing to be in the hospital. So getting the right clothes, like pajama bottoms and shirts that button down the front, like she was saying, and and having the little things that I would like to have, like lotions and, the little things. But I did some research, and talked to some other people in support groups about what were things that you really like to have, and pictures of your family, um, and yeah, slip-on shoes and slippers, and those kinds of things. That was doing a little research on what am I going to want, to help me feel better while I'm in the hospital. And then I wanted to have control over the issue of hair loss. So the day before I went in, my sister and my husband and I shaved my head and had fun doing it, and made it a fun thing. But it was also buying caps to cover it, because until the hair starts growing back, it's really cold. So it was preparing my mind for that, and getting new glasses, because I couldn't wear my contact lenses anymore, during my transplant process. And then setting up my residency. I had to live in town, so we had to find a place. So I turned that over to my son, because I felt it was really important to give the son that wasn't my donor something to do to help, because he was feeling like, oh, I can't help you because I can't donate. So I put him in charge, and he found us a great little Airbnb right near the hospital, and found, and we were right near him. He lived a few blocks from there. So he said, I'll be your backup caregiver, and lining up backup caregivers so my husband didn't have to do it all. And then having an alternative plan, because like Deborah was saying, you don't know when, timing is going to be. So we had to also line up a hotel to stay in, because I got out actually 3 weeks after my transplant, which was pretty early. And so we had to move into a hotel. So it was just having those little things lined up that was really important. And getting my mindset, putting things on my a slideshow on my phone, and a playlist on my phone, so that when I really needed my brain to be engaged in positive thinking, that kind of stuff. And I'm an artist, so I had art supplies, and just making sure I had all my electronics and everything ready to go with me. So it was just a lot of planning for not being home for 6 months, and getting my head wrapped around that. So
Thank you,
did I give you
Karen.
enough information?
Absolutely.
Okay.
Thank you so much. Rohil, how about you? What did you do to get ready for transplant? What did you and your family do?
So it was a lot of mental preparation, I guess, similar to Karen, just being ready to stay in the hospital for a long time. I knew that it would be like a couple of weeks. I ended up being there 32 days, so just like basically a month. So just getting prepared for that, making sure I had just lots of pajamas. I only wore pajamas, didn't wear anything else, nothing tight, no pants or anything like that, because I just wanted to not have anything kind of pushing, especially on my stomach, because my stomach was kind of getting messed up during transplant. So lots of pajamas, things to like easily slide in and out of in terms of like shoes, and just making sure I knew I had my electronics, my chargers, everything there with me. And because we were coming from another place, like another country, we had to find like an accommodation. And so we found, because it wasn't just my family coming over, my entire family, there's like 25 of us, came as well, just for support. And one of them was my cousin, and he was my donor, so he also definitely had to come. So that we got like 3 apartments on like a pro rata basis, or like really short-term lease in the same building, and just finding that, getting it furnished, and kind of getting settled, and finding one that was really close to the hospital, because walking would be an issue for me. And then if I couldn't walk, which I couldn't, just to get driven, and getting there really fast, because you're at the hospital 3-4 times a week, before a transplant and after transplant. But during transplant, you're just stuck there. So it's just a lot of just getting ready for the process, and just making sure that I was as comfortable as possible, even with snacks, just making sure I had my snacks that would keep me happy. I didn't eat a lot of them because I was too nauseous too, but it was nice to know that they were there.
Thank
Lee,
you.
if I could just add,
Sure,
I think
please.
I think we all alluded to it, but it was a requirement to have a caregiver 24/7 with us when we're in treatment. So my husband and my oldest daughter were my 2 primary people. And like I said, I went into the transplant at the time just after the pandemic. So while they were both planning to kind of interchange more frequently, it was kind of, we had to kind of plan which weeks so my husband was there the first 3 weeks because he wanted to be there through the transplant. And then my daughter came back, and then they would switch every couple of weeks just to give each other a break. But somebody has to be with you 24/7 during that time, because things can pop up, not feeling well or needing to go back, especially for me, we were out, like I said, lived outside of the hospital for most of this. So it was having those people to kind of stay on top of those things.
Thank you. There's a lot of build up to transplant, a lot happening, a lot of tests, a lot of preparation that goes into getting, a patient ready for transplant. How did the day of transplant go? Was it what you thought it was going to be? And what did you think it was going to be? And what actually happened? Deborah, I'll let you take that one first.
I had read somewhere the term was anticlimactic, was the word that I read about. And I was like, really? And when it happened, in retrospect, that's how I felt. I got admitted, like I said, so I knew my blood cells were flying in. And so I wish I knew what flight it was, because my family and I, we were kind of estimating as planes went over Baltimore, like this might be the one. We were joking about that. And then they came in, and the nurses hook you up if you've had blood, if you received blood or platelets before, they hang the bag, it looks reddish like blood. And on the machine, the only thing they say, don't run it through the machine, you use gravity to drop for the blood to go in. And I had my playlist ready, like Karen, we had a list of songs to play and my books to read. I had my headphones on, bebopping the music. And I want to say less than 45 minutes, the nurse came in singing happy birthday, you're done. I was like, that's it. I didn't even get my playlist over. And they wrote on my board, happy birthday. We took some pictures, and, I was texting family by then. So it went fast. It was, painless. It didn't hurt. I mean, to get blood, that part didn't hurt. Other pre-treatment stuff and all that we could talk about too, but that day it was brief, and I was happy. Then it was just wait to see what happened.
Thanks, Deborah. Karen, how about you?
Well, I was in a teaching hospital, like I said. So when everybody started coming in, it was just insane, because my donor was my son, but he had donated the week before. So it had been, frozen. So the first thing that came was this thing that looked like R2-D2 out of Star Wars. And it was the woman that had the stem cells in this freezer thing. And then they bring in this warming bed, because they have to warm the cells to prepare them to put in you. So there was that brought in, and then there was a nurse being trained on how to do this, and then her training nurse, and then the doctor came in with his there was probably 8 people in the room besides my husband and me. And so it was a big old party. It felt like a party. And like Deborah said, it wasn't painful. I mean, they just hooked it up to my normal IV pole, and there were 2 bags that they had it separated into 2 bags, and let me take pictures, and gave me the sticker off the one so I could put it in my scrapbook. And by the time it was over, well, before it was over, this was okay, about halfway through the second bag, I noticed one of the nurses went over and closed the blind on my window, and I'm like, why is she doing that? And they're all whispering, and I'm like, come on, guys, you can't whisper. There's too many of you here. And they said, well, there's a tornado warning, so we may have to evacuate to the hall. I said, well, I'm a former teacher, so I know that, we can go to the hall. Just keep going. Don't stop. Okay. But after the one thing that happened to me right after everybody cleared out of the room, they'd finished the transplant and everything, I went into this adrenaline rush, like after stress, how some people, I go into this, shaking, and my nurse is a relatively new nurse, and she's freaking out. She's like, oh my God, what's wrong? And I said, no, this is normal me. She said, no, I have to do all your vitals. And everything was fine. I was just shaking. But my husband's like, what's wrong? And I said, it's just the anticlimactic feeling of, becoming this new person. It was a very calm experience, but the buildup had gotten me so, psyched up that, when it was all over, it was like, all right, now what's next? So it was a great experience, really. The tornado never hit, so we were good.
Oh, that's good. Thanks, Karen. Rohit, how about you?
So yeah, there was a lot of buildup. I mean, they do literally have a countdown, like day minus 9, 8, 7, 6. But that's just how transplant works. So there was, there was this big buildup, and I woke up. I woke up that day on my day 0, and most of my family were outside, and I was feeling really not the best, because the day before, after radiation, I got a really bad fever, so I wasn't feeling the best. And I knew that once the bag came in with the stem cells, I immediately kind of perked up a little bit, and it took about 4 hours. I was sitting on my phone the entire time, like it didn't feel like this, like it's been said, like it was very anticlimactic. And I knew that was gonna happen, because my doctor warned me. He's like, don't think it's anything crazy, like it's literally just a bag, drips into you, 4 hours later you're good. So it was pretty big. I did cry a little bit when the stem cells came into the room. There were a few tears. But yeah, there was big buildup, but I feel like the actual day 0 is like the day where it begins. It's like, okay, now the true real battle begins on recovery, getting your cell counts back up, dealing with your symptoms. So I was more prepared for that to begin, but I definitely was a little bit confused as to why it literally 4 hours later, it felt like nothing. Like I just felt like the same person.
Thank you so much for that. Rohil, we'll stay with you. What was your greatest fear going in to the transplant process, and how did you overcome your fears?
So I don't think I was that afraid. I was more intrigued by the process, just because I study science. I want to go into medicine, and I was very intrigued and interested in how all these drugs work and how the process works and the disease and the pathology behind all of it. But I definitely was in the beginning afraid of, I'm gonna get, pumped with all these drugs and radiation. What's this gonna do to me? And there was obviously, especially at the day where I was signing the forms that had all of the kind of side effects on it, that kind of scared me the most, because the radiation oncologist talks to you about the side effects of radiation, cancer or hypothyroidism, cataracts, anything in the future, and then also infertility and having to come into dealing with that, and the fear of that possibly happening later on down the line. And I was worried about GVHD, or my grafts not actually engrafting and the transplant failing, things with my lungs, or with my liver, or with my kidneys, and all the side effects of all the medication. So reading all those did worry me a little bit, and just knowing that I'm going to have to go through a very long process of healing, and just to prepare for that, I think I use my family as support, and I would just calm myself, and just take it day by day. And my doctors, my nurses, they would also tell me constantly, like, just take it day by day. And I would tell myself, we're just going to take it day by day. My parents would say the same thing. My cousins would the same thing, that every day you'll have something new to deal with, and you'll deal with it. Like, there's all the drugs in the world to fix all these things, and there's all the people around you who can help you. So it was just really, it was more of a mental thing to prepare myself for what I was going to go through, and just knowing that I'll take it, one step at a time.
Thank you. Deborah, how about you? What was your greatest fear going into transplant, and how did you overcome your fears?
Well, like Rohel, I think when you read all those forms, I know when the doctor and I sat and talked about transplant, that I cried. I broke down. I was a hot mess. I just really was overwhelmed with what this was and all of the potential side effects. And that's what the doctors have to do. They have to tell you the good and the bad, right? They have to explain the whole process. And every one of us is very different. And the treatments may be very similar or even the same, but our bodies react differently to all of it. So there's no guarantee that everybody's going to come out the same way. So that was a bit scary, because I like to have a little bit more control over some things if I can. And I really had to let it go. But I think the thing that helped was, like Rahel said, having a good family support. I called them my guardian circle. It was my immediate family and a small circle of friends that kind of knew all the ins, outs, the goods, the bad, the ugly, all of it. And I could rely on them, and they relied on each other to be supportive for because my family was going through it. My kids, my husband, they were also stressed that I was this sick. And then it was just, I think my will that I wanted to live was really the underlying thing, that I wanted life. So this was the path that was going to get me there. And I was going to endure these, what I believe to be short-term, hiccups in the road, with what potentially could happen with regard to medicines and reactions. Those are going to be small and short-lived to give me long life, because what I was dealing with prior to transplant and running to the transplant clinic every week, trying to get platelets and my blood counts to stay some semblance of survivable, was not working. And that would not have been a quality of life for me. So it took a lot, but I was ready at that point to do something different that was going to help me be healthy.
Thank you. Karen, what was your greatest fear going into transplant, and how did you overcome your fears?
I don't really know specifically, except, I mean, like them, I did a little bit of research and did listen to the doctors, side effects and all of that. I think I was worried that I was going to feel so awful the whole time that I was in the hospital, that, how I was going to manage that. So, I was worried about that. I was worried about my body rejecting my host, my donor's cells, and how that was going to make me and my son feel. I was worried about, the fact that I was going to have to be away from family I was going to be locked up in the hospital for a while. And right before I was admitted, I was told I was going to have to be on isolation the whole time I was there, because I had tested positive for RSV, which is, the common cold. So I wasn't going to be allowed out of my room. I was afraid I was going to go crazy, because they still want you to walk and exercise every day. And I'm like, I'm going to have to walk circles in my room. So I was just worried about the whole logistics of everything, more than I wasn't worried about dying. I was just worried about things not working out and me being miserable the whole time I was there. And so that's why I set up so many things to keep my body my mind entertained, even during the worst times. And so I think that would be my answer. Those are my fears. So.
Thanks, Karen. Deborah, what was the hardest part of the transplant process?
Hardest. It was, I forget exactly how many days, but it was post-transplant. I think after the chemo, the radiation, I think it all just caught up with me, and I was so fatigued and so ungodly nauseous that I sometimes I would want to eat, but I'd taste food and it would be gross. I could smell food and I was just not interested in eating it. And just being that fatigued and that nauseous all the time just wore me down. That probably was a period that I struggled the most. But it was, I just knew that there were times where I got better. There were like moments where it wasn't always the worst. So I was like, okay, we could get through this. And I feel like I was on the upswing, and then we'd have a little lull, and so it was a lot of back and forth for several months, unfortunately. Before, and I lost a lot of weight during that period of time. So it was just a tough road, but I call them all nuisance symptoms. They weren't, they were problematic. I hated them at the time. I wish they didn't happen, but in the scheme of all the possibilities of the worst case scenarios, it was low on the end of the spectrum. And so I was like, I could survive this and get through.
Thank you. Rohel, what was the hardest part of transplant for you?
Yeah, I think mine is the recovery, just dealing with all those symptoms that you're dealing with, the nausea, the certain medications were causing my hands and my feet to burn, and having, all those, the taste change, the nausea, not be able to eat, and the fatigue and tiredness. It probably took me 5, 6 months to really get my stamina back, and just, building yourself back up probably was the hardest thing. And also because I was so far away from home, I had very intense homesickness. 'Cause when you're sick, the first thing you want to do is get into your bed in your space. But obviously I was like on the other side of the world, and I couldn't do anything because I couldn't, I was too tired to, or I couldn't go into big public spaces. So I was very, very homesick, and so that was also a very, very difficult part. But just getting back on your feet and feeling like yourself again, and working on your stamina especially, was probably one of the hardest things.
Thank you. Karen, did you experience, or have you experienced, any graft versus host disease? If so, what type, and what type of treatment?
Yeah, my biggest graft versus host issue has been a skin issue. And that started probably 2 weeks post, so it would have been about 30 days out from my transplant. And it started as just a itchy rash on the side of my neck, and it eventually went everywhere. It was painful and itchy, and it was treated immediately. My team immediately hooked me up with these creams and put me on 80 milligrams of prednisone, and it was resolved within a few weeks. And it comes back, and it comes back in little ways every once in a while, but I still have the cream and I'm still on prednisone. They're lowering the dosages. I'm down to like 5 milligrams a day now. So I'm because I'm only in the 6-month window, other graft versus host issues can pop up. Like when I thought I was getting something with my eye, but it ended up being shingles. So, your team is going to constantly be monitoring any little thing that's going on with you. So, but so far I had some GI issues right after I was discharged from the hospital, but it was determined it wasn't graft versus host issues. It was dietary issues. So, there's so many graft versus host disease issues that can happen that are other things. So that's what they're constantly determining, if it's something that we need to really worry about, or, that's what your team is there for. That's what you always contact them. But yeah, so far it's just been skin. That's all I've had. And I feel very blessed.
Thank you, Karen. Rohale, for you, any graft versus host disease issues?
Yeah, so I did get GVHD of the skin as well. I think it was like grade 3 skin GVHD, because it was on, I think, 75% of my body, and it just starts off as a rash and spreads everywhere very quickly and becomes very, very itchy. And I was also put on prednisone as well, and tapered off of prednisone for many, many months, probably for like 5 months. I was being tapered off of it. And similar to Karen with the creams, putting lots of creams on. And once I, was off the prednisone and fully weaned off, it didn't return, and so I'm very thankful for that. And yeah, but for me, it was just skin GVHD, and the steroids had helped clear that up.
Thank you. Deborah, any graft versus host disease issues for you?
I was fearful because, you just never know how that's going to show up. But I was blessed that I did not. And I was really concerned because I had some GI issues which were unrelated to aplastic, and I even had to have surgery before, I had my bone marrow transplant. So, the GI tract, your mouth, these oral areas are susceptible. So I was just feeling like they could be at risk just because they were vulnerable at this point. So I was very happy. But the doctor monitored me very closely. That my tacrolimus levels were always being monitored, trying to help minimize any onset of graft versus host.
Thank you. Next question is, how has your life changed since transplant? Rohale, would you like to go with that one first?
It's a very big question, because I feel like there's so many ways that life has changed. Either if it's just physically, like I don't feel like I'm a new person, but like, for example, I have new hair because my hair fell out and now it grew back. my blood type has changed. I used to be B positive, now I'm O positive because my donor was O positive. But I think just for me personally, if I were to go back and be like, would I'd choose, if I would get sick again or not, I would choose yes, just because of the impact it had on my life, because I feel like it gave me a sense of direction in terms of what I want to do, what I want to study, or and also just I'm here doing this, I'm also doing research in bone marrow transplant and stem cell research, and I'm also a peer support volunteer for AMDS as well, and for me that brings me so much joy, and so I also have this great story that I can use, and I've learned so much in terms of myself, and I know what I can go through, and I can relate to so much more that other people have gone through, and use my story to for other people, or just for myself, just knowing that if I could have gone through this, I know that there's other things later on in life that I can also go through and I can also deal with because I've gone through a whole transplant. And so I feel like in terms of my mentality towards life and what I can accomplish and what I can achieve, it's really in that regard changed me a lot.
Thank you. Karen?
Well, I'm only 6 months old, so the changes have for me have been isolation. I'm pretty much still living the COVID life, trying to stay away from people as much as possible because of the vaccinations. But what's changed in me mentally it's really changed the way that I don't seem to stress out about things as much. I've stopped worrying about the possibilities because I know that the worry's not going to help. It does nothing but stress me out. So I think the biggest change is I don't overreact to the little bumps that I hit and the curves in the road that I keep coming up against. It's a very different. I feel very different about my health too. I'm very careful about what I'm eating and drinking, and I don't. Somebody said, "Well, don't you miss having a glass of wine?" I'm like, no, I really don't. It's not healthy for me. The thing, don't you miss going to restaurants? No, I don't, because I know that it won't make me healthy right now. So it's just this different attitude that I don't regret. I don't miss the things that aren't going to help me improve my life. So it's just a different attitude. I'm just not as, like I said, I'm just not as worried, because I know that, like Rahil said, I can get through this, and so give me a bump in the road. All right, let's deal with it. Like the shingles that I had last week. Oh well, okay. Treat me, tell me what to do. I'll get past this. So I guess it's just an attitude of things don't bug me as much. That's it. That's the biggest change I've found so far in my life.
Thank you, Karen. Deborah, how about you?
I think similarly, I learned that I was stronger than I thought, because my journey was long, had several, I don't even want to call them bumps in the road. They were potholes and craters. But to survive. And I think where I'm at now, I just returned to work this year in February. So I've only been back to work, which kind of completed the puzzle for me, with all the stages of recovery and returning to healthy. But my outlook is different. There's things I want to do. I think I was there just getting older, recognizing I need to do things, but this changed my perspective that I need to do what I want to do now because things are so uncertain. And I described to people that I got sick on a Friday in October 2017. And by Sunday, I was in the hospital and the world stopped, everything changed. And it never, it just didn't come back to the same way. It wasn't like overnight. This is a marathon. Anybody who's in treatment right now, this is a marathon. It is not a sprint. It is slow, but progress does happen. And so at this point, I just want to enjoy my family. I want to enjoy my friends. I wish COVID wasn't around because there's more things I would like to do a little more freely, but I have to be mindful of the universe in which we live in. But I'm trying to resume some of those semblances of normalcy and enjoying my life. Like Karen said, I'm not letting small stuff stress me out because it definitely is small compared to what we've all been through.
Thank you. And our last question is, what is your best advice for someone who is considering a transplant, maybe going through a transplant, and is now living after their transplant? Rohil, you want to take that one first?
I think there's a lot of advice that you can give. I could sit here and talk for hours about advice, but I feel like the most important thing is educate yourself and keep yourself educated, because what you're going through is, you're going through it, and you have a responsibility to understand your disease, how transplant works, and make sure you speak to your doctors, ask questions, be as involved in your medical care as you can be. For example, with me, I would dictate when I would get my transfusions. I would have to get pre-medications for platelets, because turns out I'm allergic to platelets, and I had to find out the hard way. But they would put me to sleep, and I didn't like being asleep during the day. So if I needed platelets, I would tell my doctors, my nurses, could I get it during the nighttime? Because I'm an adult, I'm not going to go trip and fall like a child would, and hurt myself. I you don't have to worry about that with me. And so I get my platelets at night, and try and be as educated as possible, because it makes a big difference, because there's a lot of medical jargon and you're going to get confused very easily, because there's a lot of big words, and it's a lot of very complex biology. So just be educated. And I guess for advice after transplant is, you've gone through something, or you will, or you have gone through something so momentous in your life. Use it to your advantage, own it, be proud of it. I know I use it whenever I can. My story, in terms of if I'm able to help someone through my story, I use it. If I'm able to, get somewhere in life through what I've gone through what I've learned, I use it. So just, own up to what you've gone through and be proud of it.
Thank you, Rohil. Karen, what's your advice?
The first thing I say is listen to your doctors and your transplant team about what you can and can't do. I've talked to many people on different support groups, and many people that are going through this experience who didn't follow the rules and ended up back in the hospital or ended up with issues. So listen to your team, but also listen to your body, and you're the best advocate for your treatment. And if you think there's something going on, don't hesitate to call the clinic that you're associated with and ask them the question and determine whether or not you need to go in to see them. Keep a journal of your symptoms. Keep a daily journal of how you're feeling and what you're doing every day, because I think that's really helpful, to not only following your journey, but to being clear on when something pops up, because that's indications that your doctors need to know, and your transplant team needs to know. So that's it. And the other piece of advice is, remember, this is all mindset. You can make this experience as terrible as you want it to, or as good as you want it to. And if you decide that you're going to be miserable the whole time, you are. But if you decide that you're going to do the best you can to keep a positive attitude no matter what happens, it will really change your experience and make it a positive thing. I mean, I've met so many amazing people through the support groups and the different conversations I've had about my disease. It's just been so enlightening and so wonderful. So, make the decision of the mindset that you want to have during your experience. It will impact your recovery. I truly believe it impacts your recovery. So thank you.
Thanks, Karen. Deborah, what's your best advice?
Well, I don't know if I could top what they said, because really education is key. Like I said, I'm somebody who likes to know things. But education is about the right sources. So like AAMDS was a go-to for me. NIH, looking at research that is well documented, well founded, so that you're getting good information about your disease and the treatments that follow. Having a good medical team. If you're not satisfied with your doctor, I would recommend that you seek one, and you want someone who's experienced in bone marrow failure diseases, and then specifically your condition. And if that's not who you are with, then that may be something you might want to consider, because the right team is going to make sure all those other components are in place. The journaling for sure. And I'm a digital freak, so I have my iPad. I would walk into clinic every day with my laundry list of notes and symptoms and questions, so that I could bring them in to talk about them, because things happen in small intervals, and maybe over, maybe not every day, every other day, but you want to track those things so that you can monitor. And yes, I think, Karen, listening to your body is very key. And I even say that now to my husband and my kids, like, if something doesn't feel right, do something about it. The body tells you things, and we shouldn't ignore them. Similarly, I own the disease too. I mean, this has been a journey. When it's appropriate, I tell people about it. I use it as a way to help right size what I think and feel about things around me, and use this experience as a barometer. How bad is this, considering you've been through all that you've been through with the bone marrow transplant? And have fun. I mean, as hard as some things have been, we laughed about, when I was getting blood transfusions in the beginning, and that it was Halloween. It was this time of year. My husband and children were laughing at me. They said, "You're going to turn into a vampire. Can we see you in the mirror?" We'd laugh about stuff. Or, I saw a patient dress up her IV pole with Lay's when she would go into transfusions, because she's like, "I got to drag this thing around. It needs to be fun." It just, even in the midst of this, and it may seem like the worst of the worst, there are moments that are fun. There are moments we could laugh. I may do something that's silly because of reaction to something, but it's humorous and we can laugh about it. It's okay to laugh about it. It doesn't mean you're not taking it serious, but it's a way to get through.
Well, thank you all so very much. Thank you, Deborah, Karen, and Rohel, for spending your time with us today and sharing all of your experiences regarding your diagnosis and your transplant, and now your best advice for everyone to be able for living after transplant. So thank you all very much from all of us. And if you'd like to watch this webinar again at a later time, it will be available on our website in just several business days. If you have additional questions, you can send it to us at any time in 3 ways. Send an email to help@aamds.org, call our helpline at 800-747-2820, or you can submit your question to our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, I'd like to thank you for joining us today, making us your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 39 years. This concludes our program. Thank you guys again very much.